Welcome to the podcast, The Thyroid Code, where we bring together a multidisciplinary team of experts from Medcare Hospital Asafa's Thyroid Clinic to make thyroid care easier to understand. Today's topic is, could it be your thyroid? Dr. Yasmeen, Dr. Sandeep, Dr. Ghodratollah, welcome to the podcast, The Thyroid Code. Thank you for coming today.
Thyroid gland is a butterfly-shaped small gland in the neck, which is very important and very crucial for the metabolism. The symptoms are very vague and it's hard for a patient to understand what's going on. Let me simplify it. You can just have simple weight gain, fatigue, body aches and pains, and this might say that you have a lazy thyroid. And on the other hand, you might feel anxiety, palpitations, tremors, weight loss, or in females, they may have menstrual irregularities, which again may be the sign of an active thyroid. Well, as a clinician, we see a lot of patients coming to us and they think it's possibly because of the stress. But actually, if you have stress, you are anxious, you feel fatigued for more than a month, make sure it's not your thyroid. You can simplify it visiting us, and a simple test will differentiate whether your thyroid is normal or abnormal. See, the first thing when the patient comes with these symptoms, and the symptoms are there for more than 4 to 6 weeks, we do a simple test which is called TSH, thyroid stimulating hormone, and maybe we might also ask for a free T3 and free T4, which are the hormones coming from the thyroid. It will answer a question whether the thyroid is okay or not. This is a simple blood test which will take around 2 hours for the results to come, and we can easily communicate with the patient. When the patient comes, definitely it depends upon the age of the patient. We have to do some screening tests for them, like the sugars, the lipid profile. But when we think about the symptoms the patient is having, they specifically point towards the thyroid gland. So the best answer at that time is to do a thyroid function test. So when we get the blood test, it's not only the blood test, we need a proper communication with the patient, take a detailed history, any family history of any thyroid disorders, and then comes the examination is very important. The examination of thyroid will give us an idea whether the thyroid gland is enlarged or not. If we see the patient's gland is enlarged, we see there's a neck swelling, which even the patient notice. A female, they're very careful that when they do, in the morning they do their makeup or they do their, they can see on the mirror that there is a swelling, which is very obvious mainly to females. And they at that time, ultrasound is necessary to see the size of the thyroid, to see if there are any nodules in the thyroid, which are to be evaluated further by our thyroid care team. And we will refer the patient to the radiologist, and he will do an ultrasound. He will see the nodules, what type of nodules are there, and then it will be passed whether the patient needs further evaluation. But for the general public to know, thyroid nodules are usually benign. They are not cancerous, so don't be afraid of that. In the general population, if you see 20 to 40% of people have nodules, which may be small, but there are different, my colleagues will be here, they will tell how to intervene, what to do when they see nodules.
Usually whenever there's a concern for a dysfunctional thyroid gland, the clinicians refer the patients to us for a routine screening thyroid ultrasound. Honestly, it's the fastest tool to tell the referring physician and the patient if something is happening in the gland, faster than blood tests as well. So a patient comes into the clinic, we do the ultrasound. The whole process is about 15 to 20 minutes. Once we do the ultrasound, we can relay the results back to the referring physician in another 15 to 20 minutes. So within the hour, perhaps in the same visit on the same day, the patient's anxiety is completely alleviated. Initially, they were like, what's going on with me? Now they have a more definitive answer in terms of, oh, there's nothing scary going on with me. So when the patient comes to us, we do the ultrasound. There are a whole bunch of metrics that we look at: size, shape, morphology, texture. You think texture in terms of touch, but we think of texture in terms of ultrasound texture. These things tell us if the gland is underfunctioning, overfunctioning, is there an infection, is there inflammation, is there a benign lesion, is there a cancerous lesion? What is the lesion doing to the surrounding structures? I mean, you have important structures sitting right around the thyroid gland. Are any of these affected? We have patients coming in telling us that my neck feels heavy, it feels swollen. They don't know what's going on. The referring physician does not know what's going on. With the ultrasound, I can tell the patient, look, your gland's gotten big, which is why you're feeling that pressure and discomfort. Your gland looks like it's either underfunctioning or overfunctioning, or there's something moderately concerning in your gland that requires further evaluation. Based on the entire process, we have a whole scale. There's a thyroid reporting and data system. That is global gold standard. That is like a traffic light system. Green, you're good. Yellow, you know what? There's a chance you might need more to be done. Red, oh, this is not good. That's the kind of information we provide in ultrasound. If we find something that's of concern, we pass it on back to the referring physician or to the surgeon.
Well, when surgeon come into picture or interventional radiologist, then we're talking about whether needle or knife. The first part is the needle, because when we see something that it rings out or raises a red flag or a yellow flag, as doctor said, Dr. Sandeep, then we have to do something about it. That's the biopsy. So the issue is the tissue. There are different type of biopsies that we do, definitely, but particularly for the thyroid gland, we do fine needle aspiration. That means that by looking by the help of ultrasound, we call it ultrasound guided biopsy, we insert a small needle. And something to add, it's very important to get the patient on the board. So we should be on the same page. When we explain things to the patients, then they understand what's going to happen from A to Z. This journey, which we get together, it's much easier. And for me, yes, it is a journey. My job, though, it's when it comes to surgery, let's say that FNA shows that patient needs surgery. Why? Because this is either a cancerous or suspicious lesions. Surgery is done for some indications. Maybe I should mention that. What indication is that? We do a biopsy and it's a definite cancer or suspicious, and we cannot leave that one. We remove the thyroid. That's a surgery. Then if somebody has some lump which is growing, it's obvious, it's bothering. There are some symptoms, we call it compression symptoms, which is, thyroid is over there, it's close to our esophagus, so it can compress on that one. We'll have maybe difficulty in swallowing. Patient, we call it dysphagia. Some people, they have problem breathing because this compresses the trachea, and especially when they are sleeping. Sometimes we have change of voice. Remember, they have vocal cords which are innervated, and there is a nerve over there on the both side or posterior back of the thyroid glands. If there is compression, this might change the voice, and that's another symptoms. So these compressive symptoms are the indications to remove the thyroid away from having a cancer. So surgery is not done only for cancer, for non-cancerous states also, and also cosmetically. If somebody says, okay, I don't want this one here. And this is, of course, patient preferences there also, that they want to remove something. Yeah. These are the details, whether they want to remove the complete butterfly or half of it, but these indications. Surgery and whatever we do is always tailored to the patient's need and to the best benefit of the patients.
Thank you, doctors, for joining us on the Thyroid Code podcast.